Can you believe it? Mainly left-wing voices are saying bring back the masks and mandate them, even though in my view there's very little evidence that they did anything to stop COVID or will do anything to stop the flu virus. But let's get the facts, shall we? From Jamie Jenkins, who is the former head of health analysis at the Office for National Statistics. Hi, Jamie.
Yeah, good morning, Mark. I love your mask. Is it a Christmas present?
Yes, indeed. It's an early stocking filler, and I'm so delighted to have it. I'll be having it fumigated later. Jamie, can you believe that we're having this conversation all over again?
Well, no, I can't believe it, Mark. We've probably discussed many times over the years the old mask mandates, and it was a great clip of you back in the day. I think it's one for the archive and keep showing that every Christmas. But so let's look at some of the facts. So one of the things with the pandemic that we had, there was obviously a lot of opportunity to actually see if there was any effectiveness of masks in a real world situation. Let's not talk about labs, because we're not talking about laboratories here. Let's talk about real world situation. So the ONS where I used to work, they did a kind of an infection study, of COVID infection study, and they looked at what was the likelihood of testing positive for COVID for people who never wore masks and people who wore masks. And I guess what the answer was, Mark. There was no statistical difference between the two. And I think in the Department for Education as well, they did a study where they looked at the school absenteeism. So they were looking at basically schools that had masks enforced, and it was horrible for the children, and schools who didn't. Was there any significant difference in the number of pupils who were absent? And guess what? There was no significant difference. And at the time, Chris Whitty was saying that, there was no real strong reason to be wearing masks. And all the medical experts at the time were saying, don't think you need them. It all got brought in. So why we're going down this road of suggesting it again when there's no new evidence to suggest it? It's just a charade, I think, Mark.
It is. Polly has messaged the show, Jamie, to say if masks are mandated, I certainly won't be conforming. I've had enough of that rubbish during COVID. The issue is that this flu virus is very nasty, Jamie. I've got friends and loved ones who have had it. It's a brutal strain that's going around at the moment. It's actually very serious, and it's a headache for the NHS. So I understand that. But therefore, can we please have policies and advice that actually work? My issue with the masks is it's theatre. If you've got a stinking cold and you stay home, well, that's a policy that works.
Yeah, and the issue, if they keep talking about wear masks, if somebody genuinely has got the flu and they're coughing a lot and they think, oh, I'm going to go out, I'll stick a mask on because it'll be fine and then nobody else will get infected. Well, it doesn't work like that, does it? So it's more sensible. We don't need a national lockdown for this, but if somebody genuinely is ill, if they can just isolate themselves, and then normally if you're really ill with the flu, Mark, you can't get out of bed anyway, so you'll be isolated just because you can't get out. So the suggest that putting the masks on will fix it. Jonathan Van Tam, another medical expert from the pandemic, he was into it on Radio 4, I think, talking about he wouldn't normally wear masks. And, let's trust the science on that. And I've been back and forth hospitals the last couple of weeks when my family members is in, Mark. And the staff, because the hospitals have mandated, obviously, visitors going in. But the staff have to wear them. And many of the staff are really frustrated with this because, okay, put a mask on 5-10 minutes, half an hour when you visit in, but some of these staff have to wear it for 12 hours, Mark, and it's not good for them. So, trust the science we talked about. There's no science for this, so let's just not go down that road again.
Well, stay with us, Jamie, and that's the thing, Claire Pearsall. These masks, the science around them is flaky in regard to stopping the transmission of COVID-19 or the current influenza outbreak. Who knows? Maybe there is a 0.5 or a 1% improvement. Well, that's negligible, isn't it? That's like a rounding error. The issue is that with the science so debatable, we must focus on the harms. It's not good for your health to cover your face for 12 hours. And it's very bad for society. It has destroyed the confidence of people, especially children. And by the way, they're very bad for the environment as well.
They are. People just discard them onto the street, leave them to wash up on riverbanks, which is an appalling state to be in. But I do think the harms that were done to children have not been fully acknowledged by any government or any minister. And I've seen it working as a school governor in 2 separate schools. That what happens is those children brought up in the pandemic at different stages now, the problems with things like phonics and confidence and mental health are becoming more exacerbated, and you can pinpoint that back to things like mask wearing, where children couldn't see the face of the adult, they couldn't read the lips and expressions of people, but also the isolation. And I don't think we've done enough work to square that away, but also to acknowledge that it happened.
We need, Jamie, don't we, to just pay respond to the idea of masks having any impact on a seasonal respiratory virus, we've got to just end this conversation around masks. They're not a solution. They don't work.
No, and what is the better solution, Mark, is if you think of the NHS, and you can guarantee every single year that around this time there'll be Guardian headlines that the NHS is in crisis and is going to fall over. You can go back on the internet and search the last 20 years. It always happens. You were right, though. We have got a kind of a strain of flu, a mutated strain of flu, and this generally happens because what normally you look at the southern hemisphere, what strains are circulating, and try and work out what might happen in this country. So there is this mutant strain of flu, but when I go to hospitals, Mark, it's generally elderly people who are in hospital. We've got a massive kind of increase in the number of elderly people now than we had, say, 10 or 15 years ago from those post-war baby boomers. But the number of hospital beds and overall hasn't really increased, and this is only going to get worse. So what Wes Streeting and the other devolved health ministers need to be thinking about is not telling us next year wear masks, the NHS can't cope. They need to be putting the infrastructure in place, Mark, to make sure the NHS can cope, because this is going to continue every single year. You know, it's pretty obvious we can forecast this. Will they do it, Mark? They probably won't.
Very briefly, Jamie, and also Claire as well, this is theatre, isn't it? With the masking, it's the equivalent of the arrows in the supermarket. This is the authorities being able to say they've been seen to do something, that it's about protecting their backsides by covering our faces.
Yeah, and just one final thought for me on Mark. Remember, Christmas a few years ago, and I think in Wales specifically, you could go to Tesco, but they closed off the book aisles because it was a non-essential item, and so it was mental. And one final point, actually, remember the days, Mark? You could go into a restaurant, you had to go to the bar and wear a mask because it was dangerous. But when you went and sat down for 2 hours eating your meal just around the corner, you were fine without any masks because the virus obviously didn't come down there. All theatre.
It was all theatre. The world's gone mad. Well, you spoke very sensibly in the course of that pandemic, Jamie, and look forward to catching up soon. Jamie Jenkins